everybody. Thank you for coming to my presentation. I'm going to be talking to you about breastfeeding today versus formula feeding and why I think it's very important that you choose breastfeeding. One of my first things I want to say is this speech is kind of geared towards people who have the choice for breastfeeding. So lots of people can't breastfeed because of medications that they take, or they're just not able to pump the amount of milk that their child needs. So it's geared towards those of you that do have the choice. Sorry, I know you don't have the choice yet. So breastfeeding is one of the first choices you're going to have to make once your baby's born. So it's very important what you choose to make sure they're getting the right nutrients. A statistic I want to throw out to you is that the American Medical Association, American Pediatric Association, and the World Health Association all say that breast milk is by far the best nutrients you can give your child. So just saying that, you guys should be leaning towards breast milk already. Right before you deliver and a few days after is when you develop colostrum, and that's a thicker milk and it provides antibodies as well as all the essential nutrients to your child. Okay, after that you get, and it has a small amount of colostrum, so the infant's stomach is really small and it only needs a little bit amount of nutrients, whereas formula feeding, you don't know how much you're giving them, and a lot of times they end up spitting up because you're overfeeding them. In the next 3 to 5 days, you develop what they call mature milk, and it still has all the essential antibodies that you need and nutrients, and it's easy digestible because there's only lactose, protein, and water in it. So that immature digestive system of your baby makes it really easy for them to digest. If you use formula feeding, your diapers tend to turn out like this, and you got to change them frequently because they're nasty and you diarrhea a lot. Or you can go to like a more cleaner diaper using breastfeeding. There are some other advantages to breastfeeding. I already talked about antibodies that are transferred through the breastfeeding. And so if you go to formula feeding, you're not getting those antibodies. So your child's more likely to get ear infections, respiratory infections. They even say a lot of children can develop asthma, allergies, diabetes, obesity, all kinds of stuff. So that right there, giving those antibodies to your child through breastfeeding can eliminate those issues. So that's one reason to do it. You don't have to take your child to the doctor as much. Another reason is adding a child to your family is a lot of money. So the way you can get rid of expenses is go with breastfeeding. It's free. It's available at all times, fresh. That's another reason formula adds up, and we talked about the doctor's visits. So now you're going to have to spend money going to the doctor and paying co-pays and paying for medications and over-the-counters. So there you go. You can save an extra $1 or $2 just by choosing breastfeeding. Another good reason is that it's convenient. So anytime you are ready to breastfeed, you don't have to go out if you run out of formula. You don't have to get up in the middle of the night and warm up a bottle, and you can just be available at any time. And mothers tend to be more active too because they don't have to worry about packing enough food and bottle supply. So that's another good reason. Another reason is that skin-to-skin contact. You want to make that bond with your child and get that skin-to-skin contact at the beginning. So that's another very important reason. And those are all very important reasons of why you want to do breastfeeding versus formula feeding. So some common reasons why women don't, because it seems like you'd already be leaning towards breastfeeding, and why would you not choose it? But some common reasons why women do not choose breastfeeding is pain is usually the first reason. Very painful, and they say that pain usually, I haven't done breastfeeding yet, but they say it usually lasts 1 to 2 minutes as far as at the beginning, and then that pain usually lasts 7 to 10 days. That's not true for all women, but they do offer lactation consults at the hospital, so they can teach you the correct ways to do it if you're having pain, and so you have all these different options and you can get educated on the best way to feed your child. And the other part of that pain is that you just went through a delivery, one of the most painful things in your life. So if you can manage that pain for that first 7 to 10 days and get through it, then I think the benefits of what you get from it outweigh those painful moments. The second reason a lot of people don't do it is time consuming. We only produce a small amount of milk at a time, so frequent feedings, up all night, can be very time consuming, especially if you're going back to work and doing things like that. Again, what they say in their studies is that within that first month, you develop a rhythm of breastfeeding, and once you develop that rhythm, people can help you out, family members, father can get involved and help feed the baby. So really stress yourself out, time-consuming sleep for a month to get that breastfeeding, and then at 3 months, they tend to not need as many frequent feedings. So I think 3 months of really pushing yourself and being tired, like I said, for the benefits of not having your child have all those risks for infections is definitely worth it. So those are some big reasons why mom doesn't do it. And the other reason is because they have to watch their diet still. So anything, drinking, diet that they're taking in, is stressful to have to keep doing that. But once again, you've done it for 9 months, pull out for a little bit longer and get all those benefits. So we talked about baby. There are a few benefits for mom as well, so if those weren't enough. Mom, like we said before, she feels that confidence that she gets to give that baby their full nutrition and make that skin-to-skin contact. Also, they say breastfeeding burns calories. So I know a lot of us want to get back to our pre-pregnancy weight, and that can be difficult. So not even putting out effort of going on a treadmill, you just got to feed your baby. You get to get back to that pre-pregnancy weight. And so those are some good reasons for mom. Also, they say there's decreased risk of stuff like diabetes for women, uterine and ovarian cancer, hypertension, breast cancer. Those are all lowered in breastfeeding. So not only are you benefiting your child, now you're benefiting yourself as well. So those are all some reasons why. And I'm going to give you a little scenario just to put you in kind of a situation. If you came into a hospital and you were sick, and you were given an option to take 2 medications. And both of these medications are going to cure whatever illness you have eventually, in 3 months, let's say. So medication A is going to be kind of like your formula feeding. So it's 3 times a day, which is very frequent, and it's a pain in the butt, and it's going to be given in shot form, so painful. But during that, at 3 months, it's gone. Did I say A is formula? I'm sorry, A is breastfeeding, so frequently, 3 times a day with the shot. And so it'll be painful, but you're going to have no side effects during that 3 months and no side effects after. Completely done with your illness. Other medication is B, and it's going to be like your formula feeding, and it's going to be really easy. Just pop a pill once a day. But during that whole time, you're going to have tons of side effects. And then afterwards, after that 3 months, your illness is gone, but you're going to have other side effects. Which one are you going to choose? So that's how I kind of look at breastfeeding and formula feeding. And I know we kind of went over it, but are you going to choose a little extra money in your pocket? A happy baby? Rock hard abs? A clean diaper? Or are you going to choose this baby with a sad face that has to go to the hospital and a dirty diaper? All in all, I think you guys are leaning towards breastfeeding, and I hope that education today helped you. Thank you. Any questions?